Hello everyone, and welcome to this webinar from the University of Wolverhampton on how children's social work will respond as we emerge from the pandemic. I'm just going to leave it a minute, give you everyone a minute to join, and then we'll get started formally. So I will just do some basic introductions in terms of the webinar and laying things out, and then I'm going to hand over to Tim Steele to introduce our panelists for today. So it's just to remind everyone that that this is it is a Zoom event, so it's a public event. It is being recorded, so just to be careful about not putting any personal information or private confidential information into the chat. You're welcome to use the chat, but if you have any questions for any of our panelists, could you put them into the question and answer box, just because it's easier for me to find them rather than sort of rummaging through people's chat. So with that, I will hand over to Tim Steele, who will introduce himself and our panelists today. Thank you.
So thanks, Susie. Welcome everyone. My name is Tim Steele. I'm Co-Vice Chancellor Global Opportunities here at the University of Wolverhampton, and we're delighted to welcome practitioners, managers, colleagues from local authorities and colleagues from around the world joining this webinar series, which I know forms an important part of many people's CPD development. My background is in internationalisation and business, but I have been really fortunate over the last 12 months to lead a project to develop a £5 million new centre of excellence at our Telford campus around health and social care. And I've been really enjoying the opportunity to learn more about social care and how that plays such an important part around the UK and around the world. Today's event is about how might COVID impact children and social work's practice as we start to come out of the pandemic, and we've certainly seen that with the work around what universities do about how we change, how we learn, how we teach, how we brought more simulation learning into the classroom, and we're all asking these questions, so I'm sure you're going to have a really interesting conversation over the next hour or so. We're really delighted to bring together a prestigious panel of speakers for you. We're joined by Isabelle Trowler, who is the Chief Social Worker for Children and Families, so welcome, Isabelle. We're joined by Alison, Hinds, who's the Deputy Director for Children and Social Care at Wolverhampton City Council. We're also joined by Jacqueline Gregory, Senior Practitioner in Education at Birmingham Children's Trust. And finally, really learning from what's really happening on the front line as a student, we've got Serena, Ashaq, who's a final year student here at the University of Wolverhampton. So I'm going to stop talking. I've probably spoken for too long, Susie, and hope that you have a really good conversation, ask plenty of questions, and we look forward to listening to our speakers this afternoon. So thank you and welcome.
That's great. Thank you very much, Tim. So we will begin our webinar today with Isabelle Trowler. So handing over to you, Isabelle, and thank you very much for agreeing to take part in this.
everybody. Can you hear me okay, Susie? Yeah?
Yes, yes, I can hear you.
Okay. So I'm going to talk for about 15 or 20 minutes, I think. And thanks for the introduction. Thanks for the invitation. It's a really important conversation to have. And I'm going to reflect on the last 12 months or so, and from a very specific position, I suppose, somewhere between frontline practice across England and the corridors of power in Whitehall, and what I've seen shift and change and what that might mean for the future. So firstly, and I've said this elsewhere, I think we're all changed by COVID. I think the psychology of what has happened to us is really profound, and I think as yet unknown. And we have yet to experience the full aftermath and consequences. We've all experienced to different degrees loss and change. And we've all shared a national experience, a close proximity to death, separation, fear, being out of control, an experience of state intervention into the minutiae of our private lives. And for many of us, that's a first, you know, to feel the weight of the state, who I can see, where I can go, and for my own good, not fully understanding anything and having to trust an anonymous power with that minutiae of our lives, and at points with no end in sight. And so as the story unfolded earlier, you know, we found ourselves holding two interwoven positions. And I think that this was the same for all professionals. You know, there was this sort of very calm, strong sense of responsibility and purpose, almost kind of business as usual. But it also felt a bit like being at the beginning of a disaster or horror movie. That's how I felt, that something somewhere was gathering enormous pace, a sense of a rapid approach of something really invisible. And I'm sure everyone in public service had moments of thinking, just even for a few seconds, that this was potentially the start of social collapse. You know, anything could come over the hill. But for this audience, this context is not so new to you. So certainly my prevailing sense of being a social worker right through to senior manager is that you never know what's coming over that hill. And you're having to respond professionally and calmly, no matter what. And for all of us, we are constantly involved in that kind of worst case scenario planning. But we had some very immediate and key concerns for children's social care. So how the infection would impact on families through illness and death and separation, the impact of workforce absence and skeleton services, police and court protections not necessarily being available, family stress and isolation relating to family breakdown and child abuse. The interconnectedness of our lives was becoming really sharply understood, as was the complexity of the work that we do with families and communities. And I think that this fine balance that social workers and colleagues walk alongside with families was revealed, and actually that we have very little power in our day-to-day practice, and that the relationship is really the only way through which we can influence what happens with children and families, other than through the courts, of course. And I think that that's been a real wake-up call in certain circles, you know, in my department and elsewhere, that we are actually really limited by the things that we can do. There were massive lines of communication across government and across agency. The practice leaders and principal social workers across England have had, you know, unprecedented access to Whitehall, hugely influential, helpful, constructive, all the way through. We set up a National Vulnerable Children's Board, first time in my 7 years in government where all the national leaders were around the table at one point every week. And what took us so long to get to that point? There was very disturbing and initially unspoken but very visible racial disparity between those who were dying and those who were not. And further down the line, we have seen the relationship between infection rates and deaths and what we refer to as health inequalities. Child protection has had an increasing focus across government. Colleagues who have never really been close to the world of children's social care, for me, it's been like seeing the light switch on and just how much responsibility that you carry on a day-to-day basis. I think there was an incredible amount of local partnership working and activity, local authorities, all their community partners, streets ahead in getting emergency arrangements up and running. You know, everybody discovered their own agency. It's local authorities, you know, who are sometimes beleaguered by Ofsted ratings, they just got on and delivered just as well as anybody else. You know, all that categorization of gradings and the nuance that they mask, you know, it just collapsed under the weight of people just doing the right thing for children and families. So I think that we saw enormous flexibility, incredible goodwill and role generosity, and incredible kind of fleet of foot. I think our young people, our children, have been exemplary citizens, the vast majority complying with these really incredibly complex rules, very little trouble on the streets. And, you know, this was a tall order for children and young people for such a long period to be away from friends and trusted adults, schools and routine. All of this was out of the door. And I think families utilise their own resource and strength, and some have found strength that they never knew they had. Not being at school has been a blessing in disguise for some children who were much calmer and happier without having to face school every day. And although everyone is now starting to worry about increases in elective home education, that I think that many children and young people are very pleased to be back at school, and parents too. Lots of stories have looked after children actually preferring digital modes of communication, finding it less intense, more flexible, and some young people wanting more contact with their families for the first time in a very long time. Hidden harm has obviously been a big concern, lack of contact with wider families and the loss of other protective factors, loss of opportunities for social contact, you know, play groups, outdoor facilities, extended family support, growing pressures and tensions in overcrowded homes, disrupted routines, and of course the social and economic pressures of furlough, financial loss, shortages of food, etc. You know, this has been a major pressure point for families. There are many, many consequences of all of this that, and as I said earlier, that we don't really understand yet as a nation state. I think we have a lot to discover. I have said publicly in many places that I think children's social care has done a brilliant job. The professionalism, the resilience, the tenacity, and the speed with which frontline practice just changed. It was truly incredible. And I think a sense of many of those barriers just falling away. So, you know, children's social care overall has held up extremely well, down to everybody's hard work and commitment. Tiredness, I think at points certainly set in. I think there's been real struggles for students and newly qualified social workers who are coming into this, you know, quite complex work, but without the mutual support of teams and organisational infrastructure around them in the normal way anyway. So we've got lots to process about virtual practice and the benefits of face-to-face interaction. One of the things that I really noticed was the speed with which we were able to communicate, and in some respects that's a really good thing, but of course what you do is you lose the space in between those meetings and conversations, and it's within that space that you're often processing this complexity of the things that we're having to work through. Lots of debates about child protection conferences. So I think by and large, families found it very difficult not being there in person, but we've also seen a much greater contribution from some professionals that have found it really incredibly hard to attend conferences because of their own other priorities. We've again seen a huge shift in how the court systems had to work, learned a lot from that. And, you know, I think a lot of this is also about personal preferences. And, you know, that certainly there are real advantages of hybrid arrangements where you've got, you know, face-to-face some of the time, other online, but actually I'm discovering it's a whole new world of kind of diary management and how you kind of fit those two things together. I think the downsides of home working became more apparent over time, with fewer opportunities to mix with colleagues and access face-to-face professional supervision, peer support, just connecting, that office banter, that camaraderie, not entirely by any means, but it was missing. I think that we've seen that those employers who provided clear guidance on staff well-being, what equipment can be accessed, offering flexible working to facilitate childcare, closure of schools, etc., really helped. And feedback from the front line is that kind of approach really mattered. There's been, lots of positive praise about the social work contribution, and I constantly hear this from ministers and other senior leaders. I mean, it really has been a credit to social workers, but to all the other practitioners, I should stress, that have been involved in supporting families throughout this really tricky period. So the future. As a result of COVID, England will see many more families facing many years of economic and social disadvantage, and we know the relationship between those social factors and family stress and how that relates to family breakdown and incidents of child abuse. Nearly all of the system problems that we closely associate with social care had to be very, very quickly recalibrated. And I think that COVID might have given us the opportunity to reset the value base which underpins our work. That we have seen a very, very significant reduction in the numbers of children coming into the care system over the last 12 months. Yes, there may very well be a result of hidden harm, and it's right that we retain that focus, but it might be because of something else too, or most likely it will be a mix of both. We'd already seen a steady decline in the numbers of new children coming into the care system since 2017, but there has been this dramatic decrease through COVID. And could it be at least in part that through COVID, we have managed to release ourselves from a particular way of seeing families and what was going on for them? I think sometimes that we too often see a family's struggles as a parental deficit rather than a consequence of social factors. And, some people have described what they think has been a kinder culture of practice, that for some reason that we have been able to see families in distress more clearly, that we've been able to offer help rather than seeing that within the context within which families were living. So I think that, that there is a real challenge to us now that we have seen this reduction in numbers of looked after children, about how are we responding in different local authorities to that. There is big variance on that decrease, I should say, but something really important has happened, and we need to take stock of that. I think that also COVID has seen, as I've said, everyone thinking on their feet, just doing the right thing. And in some instances, local authorities change their whole, processes and procedures almost overnight about PPE, contact, home visits, use of tech. So that local infrastructure was much more immediately related to the needs of practice. So it was much more responsive rather than controlling. And I think that that's quite an interesting dichotomy. It didn't take very long at all to ditch what we thought got in the way of what we needed to do for children and families, and create and endorse something that worked better. And I think we just need to take the learning from that. That it's a really good challenge, I suppose, to our existing system, that all the bureaucracy that we have, often much of it we need, but it's quite a loose term. It includes important rules and processes, but the sheer volume of it represents an outdated attempt to control. And so we need to just really review, I think, what we do and why, and be much more responsive to the realities of what's happening in practice and for children and families. The relationships between children's social care and schools and health partners, the BOLSEC, has changed substantially, as I said earlier. Two other things to add before I end. I've also did a similar session with colleagues within the Department for Education, and including the permanent secretary, and also a professor from Harvard, Professor Serena, and it just struck me what he said. And he was basically saying, not that he mentioned, Wolverhampton specifically, but, the challenges that we're facing, they're not within Wolverhampton, they're not within England, they're not just within Europe. He spoke very eloquently about COVID as a global challenge, amongst other major global challenges of climate change, disease, financial crisis, digital disruptions, all of which will continue to manifest more frequently and intensely in every country across the world, producing widespread strains on states and societies, was the way that he described it. And, COVID has been this catastrophic incident, which marks the most significant singular global disruption since World War II. And what I took from the way that he described that is that you can become overwhelmed with a sense of, the scale of the social problems that we face. But actually, there was something that made me feel, we are not alone in this, that it was actually quite affirming that we were in this together, and we need to find a way through. Makes it feel less, more grounded, I suppose, a sense of collective endeavour to recover and repair. And lastly, just wanted to say, it's very difficult to shift entrenched ways of doing things, and we shifted so much so quickly, and some of it, we wish we never shifted at all, and some of it proved really positive. I think our tendency will be naturally to sort of drift back to that which is most familiar, no matter how dysfunctional that is. And so I think all local areas, have some choices to make about, what we take from that rapid shift in the culture of practice and how we respond to social need. So I hope that we have, unintentionally witnessed a very welcome recalibration of how we respond to families living in poor communities, often facing multiple disadvantages. But we also need to have and continue to have that kind of razor sharp eye on child protection. And we need to keep an open mind about what has happened over the last 12 months. And we need to, to make changes which have proved positive, really sort of sustainable and long-term. So I think that, whatever the future of children's social care is, it is, very dependent on the choices that we make now, and which your leaders and your managers and you as practitioners decide to take forward. So I'll end there and look forward to hearing everybody's contributions and to the panel session too. Thank you.
Great, thank you very much, Isabelle. That was a really helpful introduction. And I think, one of the things that I think I've been thinking most about what's happened when I reflect on COVID is, as you say, that how quickly we were able to change things, and before how difficult it seemed to make little changes, and then we just tipped our lives upside down overnight, and we sort of got on with it. And I think there's a lesson there for us, and it's one of the reasons we wanted to have this webinar, to give us a space to reflect on actually what that means for us. So yeah, thank you very much for that introduction. That's really helpful. So we'll move on to Alison, and Alison Hinds from the Wolverhampton City Council. I shall share your presentation, Alison.
Good afternoon, everybody. So, as Susie just said, I'm Alison Hinds. I'm Deputy Director for Children's Social Care at the City of Wolverhampton Council. And Susie's going to kindly just share the screen. So I've just got a few slides I can talk to you about the experience of Wolverhampton. Okay. So what a year. I think Isabelle's just talked about a summary of some of the things that we've been facing and pondering and quickly working with in local authorities. So if you could go on to the next slide, please. So casting our minds back to March 2020, we had a bit of a practice run in Wolverhampton. We knew things were escalating quickly, and as a council, we felt we needed to have a little bit of a practice run to see how things would work when we work from home, because that is likely to be the way we were going. So we had a whole council approach to everybody at home. Everybody take your kit home with you for a day and let's see what happens. You know, does the kit work? What's the connectivity like when everybody's at home? What, you know, are we going to all be able to work together at the same time when we're home? So that was the week before. We had to go at it. We didn't get much chance to decide whether it worked or not, because as of the next week, we emptied our lockers and we didn't go back into work again. And on the whole, in Wolverhampton, we haven't been back into work, into offices since. In children's social care or social work offices closed at that time, and the majority of them still remain closed to date. And we're working on what our roadmap looks like as part of a council approach, but also as a children's services approach, to making sure what we move to is the right thing for children and young people and families we work with in the city, but also meets the needs of ourselves and our partners in terms of delivery of services. So we started to get used to working virtually. We got used to new technology that we may not have used before. We adapted quickly to working on Teams, and as Isabelle has mentioned, we did that fairly rapidly. We introduced very quickly different ways of communicating, not only with each other, but with our partners and more importantly with the children and families that we work with. And what happened very quickly in that short space of time is that practice changed and our home became our office space. And I suppose we've been really conscious of that in Wolverhampton, about the impact of not only the impact of COVID and all that brought personally and professionally, but also the impact of never having worked from home before in the jobs that we do, what that meant, particularly for social workers and colleagues in social care. Next slide, please. So we've thought about what's continued to be important to us during this period. So what have we continued in terms of prioritising our social work practice? So safeguarding children and families and ensuring we continue to fulfil our statutory duties and requirements has remained a priority. But we've had to think quite carefully about how we do that, knowing that children and families aren't as exposed to other people as they have been at points during this year. But how have we continued to make sure we're safeguarding the children and young people in Wolverhampton, and doing that in a different way, but it is reassuring to us? So at the very beginning, we did some work around which children can we see virtually and which children can we absolutely need to see, continue to see face to face. As most local authorities did, we introduced a RAG rating system, and we made sure that we continued that face to face contact with those children and families that needed us most. We quickly developed some performance information to help us with that, so that we knew those children and we knew whether they were being seen and how frequently they were being seen and what the outcome of those visits were. So we very quickly reassured ourselves as social workers and managers throughout the organisation that we were seeing those children that needed us most, and we were already working with. We also worked quite hard at that point to support vulnerable children into school. And again, we had some information that supported. We worked really closely with education colleagues and school leaders to work with those children to make sure they were into school. But what we also had to do, managing alongside that, was respond to national and public health guidance and manage what came the temporary statutory guidance to how we could work with children and families. What has continued to be important to us, again something that Isabelle touched on, is our strong partnership approach to the work that we do. So safeguarding children and working with families is not just the business of children's social care at the local authority, it's a partnership approach to the work we do. And we felt we had strong relationships in Wolverhampton before, and if anybody had asked us, we would have said that. But we've built on those relationships, and the strength of those relationships is evident, even more evident in how we're working together moving forward. So our strong partnership approach with education colleagues, through Wolverhampton Safeguarding Together, our partnership with health colleagues, with the police, has strengthened through this process to reassure ourselves that we are working, continuing to work with children and families that need us most. We've developed a strong multi-agency working approach to the work we've done, and we've worked closely with colleagues across our partner organisations. A good example of that is immediately we set up weekly meetings with partners through our Wolverhampton Safeguarding Together, so that we could reassure ourselves the work we were doing as partners, where we were working together on that. Another example was our MASH. So very quickly, as other local authorities, our MASH disbanded to people working from home, and that has remained in place. And we totally believe that that is about how we have developed our communication, our systems and our partnership working to enable that to happen, and our MASH to continue operating safely in a virtual way. So in Wolverhampton, we have a restorative practice approach to the way we work. Not just in children's social care, but also adapted by our partners and adopted by the council as a whole. And we were keen that that remained important to us throughout our work. And we were continuing to work restoratively, building on a strength-based approach to the children and families that we worked with. But not only the children and families we were working with, also with our colleagues. And I think that has been crucial to how we've worked through this last year, this last 15 months. Working on a strength-based approach to how we work, and the relationships being so important with the people we're working with. Listening to our children and families, listening to their experience of the impact of COVID, both in terms of their personal experience, their impact on their family, their livelihood, and how that's impacted on them as parents and as children within households has been crucial. What's also been really crucial for us is the wellbeing and safety of colleagues, because we can't do any of this unless we've got a workforce that felt supported, that were as well as they could be, acknowledging the impact on various levels for various people of the devastation of what we've seen over the last 12 to 15 months. And so we approached and made sure that we were providing opportunity to hear experiences from the people who work with us. So we've done numerous wellbeing surveys, live in lockdown, social work, health evaluations, consultations with staff, so that we can really understand what their experience is and work with them on making this experience as good as it can be, but understanding the difficulties around. We have wellbeing portals available to all staff, ensuring we're looking after ourselves, opportunity to join events which we've promoted, desk yoga, mindfulness, chatty cafes, all sorts of things that we have tried to put in place to enable people to feel as well as they can be, acknowledging how difficult it's been. We've had management programmes, particularly for managers, to encourage and help and develop their ability to support their teams virtually, doing that in a different way without that informal interaction that you get in social work teams. But ultimately recognising how different everybody's experience has been and trying to respond to that difference. And then just around what we've been so proud of is the flexibility, creativity, adaptability and innovation we've seen whilst we've been going on, and how generally people have adapted so well. Our colleagues have adapted so well to what needed to happen so quickly, but have evolved in terms of how things keep changing and requirements change. And that is something we are really proud of. Next slide, please. So getting used to doing things differently is what we've been doing. We've talked a lot about use of technology. For some people that's been easy and we've been on a journey, but we've supported colleagues to work with the technology, support each other. We've had workshops, we've had cafes, we've doubled up. In the middle of all of this, just to make life really difficult, we've implemented a new children's social care recording system. We trained everybody virtually. We migrated all of our data. We had champions across the service, and I just think that that demonstrates how we've worked so well together to support each other through what would be an incredibly difficult process if we were sitting in an office, but even more so sitting in our own homes. So proud of how people have cooperated, managed, asked for help, received help, and I think a really good example of how we've continued to work together. We've got used to working from home. We know for some people that is much harder than for others. There are pros and cons to all of that. It is about being flexible in our approach, understanding how difficult that is for some people, making some unique arrangements for some people who find that really difficult for very different reasons, but encouraging wherever possible people to keep themselves well and work from home. We've undertaken virtual visits, again, something new we've never done before. So we've got used to using different ways of communicating with people, virtual meetings, virtual panels. I've mentioned our virtual MASH, and obviously how we've worked with the court through this process has been very different. And we're very conscious of the impact of all of those things, not just only on ourselves as professionals in social work, but also on the children and families we're working and how they receive our services in a different way. Next slide, please. So, bit of what we've learned from Wolverhampton perspective is that there are different ways that we can work with children and families. There are practically different ways, but ultimately there are different ways around how we can support children and families. We've been on a journey in Wolverhampton in terms of changing the way we worked, in terms of focusing our support through our restorative approach in a high support, high challenge way, working a strength-based approach at the earliest opportunity with our children and families in the city. And this has given us another opportunity to reinvigorate how we do that. And it's harder when you're not doing that face-to-face, but actually it's not impossible. And it is about that flexibility and that adaptability to do things differently. We've learned there's different ways of conducting meetings. We'd never have thought that we didn't all need to sit in the same room to conduct a meeting, to conduct a conference, a review. But actually, we need to think about the experience, and we're thinking about the experience of children and families in that process, and that might be, that is something different. But actually, as Isabelle just touched on, our attendance in terms of professionals at those meetings and our multi-agency approach to safeguarding, to caring, our corporate parenting approach to caring for children in care has been far better in terms of doing that together. We've touched on the importance of well-being and how important that is, and the importance of a flexible approach. The importance about thinking about communication, thinking about how you do that, how purposeful you are in your communication, in keeping people engaged, in working with people rather than to or for them is crucial when we're working in this way. And the importance of relationships in all of that, taking care of each other, understanding differing need and responding to that is important. So those are the things we will be thinking about in terms of taking forward. Next slide, please. Where do we go from here? So we're just at the moment thinking about where we go from here. What's worked well? We're looking back. What would we never want to repeat? But actually, what would we want to build in? So, you know, what are the views of children and young people? So throughout this period, we've continuing to engage both on an individual basis, but also through our participation with young people around what's worked, what have they enjoyed, how can we take some of that forward. And lots of young people have warmed to the idea of different ways of communicating with them. So, you know, that we will build that in moving forward. You know, we don't want to lose. I mean, I had a social worker say to me, I can honestly say I know my children better now than if I had trying to manage just doing visits, the travelling time, I can pick up the phone, I can FaceTime, I can WhatsApp. We have chance to chat, we have chance to really know about each other and learn about each other and build that relationship, and we wouldn't want to lose that. But that overload just form part of how we work moving forward. We need to understand the views of colleagues within our own service, listen to what our colleagues are saying, work with them around what's worked, what hasn't worked, what we want to take forward, and also around our partners. How have our partnerships worked? What can we learn from this experience, take forward? What would we want to ditch? Those are the things that are important for us moving forward. We're working on what will be some shared principles about how we work across the council, but particularly in social work. And we're working on those shared principles now. And from those shared principles, we'll be thinking about what permanent changes do we need to make and how we need to practice moving forward, just learning from some of those examples. Next slide, please. So I've touched on some of the things: multi-agency attendance meeting, getting to know our children even better, closer working relationship with community groups and supporting community resilience and strength. And that has been a key factor for us around, you know, how families have found strength through community support and how we have worked through community groups to work with our families in that crisis point at the very beginning, but how we continue that relationship moving forward. You know, being part of a one council approach in response in the early days, but how we realise our city has been crucial to us in children's social care. Part of the 6 key priorities for us in Wolverhampton are caring for our most vulnerable and promoting opportunities for young people. And those are two key out of the 6 priorities that touch us so closely in children's social care and are given high priority as part of our council approach to relighting our city. What we've seen is good continued stability of placements of children in care. We've had, on a positive, increased inquiries from fostering and adoption, people thinking about life-changing things, reflecting on how important things are for them. We will continue to take forward the importance of staff wellbeing and how crucial that is for us working together. We've experienced a strong, stable workforce, and that has been really positive through this process, with very few children's social work vacancies in Wolverhampton, so that's worked really well for us. And we've continued very differently with opportunities for professional development and social work training. And actually, we've taken more students this year through placements, but have lots of opportunities for social work training through different routes, through apprenticeships, frontline and step up to social work, which have all continued. But interested to hear the student work experience from the panel. Next slide, please. But we haven't continued as business as usual because, you know, things have changed. But we've adapted and we've been flexible, and we have continued to do the work we need to do, but think about a different way of working, and that is what we will be taking forward. Through this process, there's some key achievements I thought useful to note, that despite how, you know, the conditions we've worked with, we've implemented a social workers in schools project. We've implemented in February a multi-agency missing and exploitation hub, which we've been working on for a while with partners, and that is working really well. It's in its infancy, but it's working really well, and partners are really engaged, and that is going to be making a difference to children and people in the city. We've set up a local house project. We've moved 10 care leavers through this process into their own homes and working with 9 more young people in cohort 2. We've implemented a MASH 24, which is a restructure of our EDT. So we have a separate AMP hub and a MASH 24, whereby our daytime services and evening out of hours and weekend services run on a one service basis, whereby we are utilising shift patterns to carry on our daytime services through into the evenings and over the weekends. And again, this is early days, but is really promoting consistency of practice, consistency of culture through the evenings and through the weekends. And we've developed lots of other things. I mean, these are just a few of them. There's our online parenting programs, online training for foster carers, opportunities for learning for social work colleagues, for staff, lots of key achievements that we've managed to continue with through this process. So I think it's useful to note that. And I think that may be my last slide. Yes, so thank you for the opportunity just to talk about our experience in Wolverhampton. I think that's been really great for us to do that. It's been a real learning opportunity for us in Wolverhampton, and we're continuing to learn and take forward the learning from the last 12 to 15 months in our practice moving forward.
That's really excellent, Alison. Thank you very much for that. I think it really lays out really starkly how much change and how much services have worked in response to COVID, because what you're talking about is nearly every aspect of service. Well, not nearly every aspect of service pretty much changing. And that's been a journey on which sort of every social worker and every worker associated has had to go through. So it really does highlight what an enormous change services have been through. So thank you very much. That's excellent. Jacqueline, do you want to pick up from there? Thank you.
Good afternoon, everyone. Good afternoon. An absolute pleasure to be here. I'm just going to share my screen with you, so bear with me one moment. That's not working. Oh, do you know, it worked fine in rehearsal.
Are you okay, Jackie? Are you wanting to put it on large?
Fine. I'm going to try it again. It worked fine and now it's not working. So I'll try it again.
No worries.
Okay. Bear with me, everyone. I did say this would happen, didn't I? I can't get the box off at the top to start the screen show.
Oh, it is sharing. We can see your screen.
Yeah, but I want to start the screen show. Okay. Okay. Okay, and we're off. So, wasn't quite sure what to call this brief seminar, if you like, webinar. Wanted to go for something grand like the rise and fall, an ultimate rise of social work, but I settled on Jack and the pandemic because I'm going to tell you a story. But no good story starts without learning objectives. So I'm hoping that you take away just an appreciation and understanding of the value of reflective and reflexive supervision and the role that it continues to play post-pandemic. So I'm hoping that it, maybe just triggers some things for you sort of at the end. So, as with all good tales, once upon a time, in a land far, far away, there was a young girl called Jack. She was told at school that she was too sensitive for the rough and tumbles of school life. So she thought to herself, I'm going to show those teachers. And she used her sensitivity, she used her empathy, she used her understanding of people and situations, and she became a social worker, where she endeavoured to put all those qualities to good use. She went to university. She went to university in London, actually, and she gained a BA in family and children's studies. But sadly, her first job was not on an ASYE programme. She didn't have the support of a cohort. She didn't have regular one-to-one supervisions. Reflective supervision, unheard of. There was no specialised training, no recall training days, no portfolio requirement for your first year of practice. She was told to hit the ground running. And this is a term that she dislikes to this day. So in her first job, in her first role as social worker, she discovered the benefits of having a supportive team. She discovered that the guidance and advice that you get from your colleagues, from your team manager, from everybody who is involved in social work was invaluable. So she grew to recognise how important the team was to her practice. She used to socialise with the team. They would do bring and shares. She used to share food with the team, and she went to them when she needed support. She worked with wonderful colleagues who were supportive, open, and generous with their positive spirit. She thought about supervision, and as her career progressed, she thought, I'd quite like to be able to mentor and coach and support up and coming social workers. So her view of supervision was that it was an opportunity to share not only her highs, but her lows. So supervision, as well as her team, as well as her colleagues, became an invaluable part of her practice. I'm hoping that everybody can see this particular quote this quote in particular. The opportunity to guide others to their fullest potential is indeed an honour. It's a privilege, one that should not be taken lightly. As leaders, we hold the lives, I'll insert careers, of others in our hands. Those hands need to be supportive, gentle, calm, reassuring, strong, tough, but always, always available for support. So, part of her social work journey was doing her social work tasks, doing her visits, working with children. The joys of working with children, newborns, school age, even the challenges of working with teenagers, she embraced. She had a particular affinity with the little ones. She liked to hold newborns. She liked to touch her children, touch their toes, touch their hands, hug and cuddle them with all their sticky fingers and chocolate mouths. Her core business was SIN meetings, CP reviews, ICPCs, statutory reviews, hospital visits, school meetings, transport to placements, removals. That was what she did, and she enjoyed it very, very much. She went to homes, she went to institutions, she went to other establishments in order to carry out her social worker tasks and fulfill her statutory duties. This is what she did. I did mention the bring and share. Food brought the team together. It was an opportunity to eat within the space of an hour, samosas, fish and chips, pizza, cake, dessert, anything that you could imagine before the next visit. As far as Jack was concerned, she was living her best social work life and going about her social work business. And then one day, a pandemic struck and Jack's social work landscape changed. It was no longer business as usual. She could not go to the office and all the institutions that she used to go to before. She still visited her families, but she had to wear aprons, masks, gloves, or visits were done virtually. She couldn't touch her children. She really missed that aspect of social work. Her team manager and colleagues were not in close proximity. They weren't just in the chair next to her. She didn't bump into them in the corridors of the office. I talked about change, but perhaps it wasn't about change. Perhaps it was about developing. Because social work isn't going to change. We have a pandemic. The essential bare bones of social work will remain the same. Our children need to be seen. Our visits need to be undertaken. Our statutory duties have to be upheld. So social work didn't change. But Jack saw this as an opportunity to develop. She had to learn and refresh skills, approaches, new skills, new approaches. And one of those initial skills was she recognized that her relationship with technology had to improve. She had to understand various platforms, Zoom, MS Teams, all of the platforms used for communication in order to talk to her colleagues, in order to talk to professionals, in order to talk to children and young people. Jack had to become tech savvy. I gave the two illustrations because although I aspire to the desk on the left, my desk always looks like that one on the right. As mentioned, these are the platforms that she had to get to grips with. Though sometimes they're not ideal. As my initial intro indicated, tech can let you down. It's not always convenient. It's not the ideal medium. But what it helps you to do is prioritize those working relationships from afar. Jack realised that it was important that she connect and keep connecting with her teammates, with her team manager, with everybody involved in safeguarding her children. And she also saw that support, openness, and generosity of spirit are qualities linked to people, not situations. She became interested in super. She became interested in what it meant to be super. Excellent, superb, pleasant, first rate, top drawer, wonderful, first class, superior, outstanding, dazzling. Have I said fabulous? Fabulous. All words that mean super. This got Jack thinking about vision. To see, clarity, sight, oversight, hindsight, foresight, wisdom, aspirations, imagination, inventiveness, creativity. To see, to just see. You put those two separate words together and you get supervision. Jack saw that supervision led to a more deeply conscientious, humanistic way of practicing as social worker. But she wanted more. She wanted more. She wanted to learn more about her development coming out of this pandemic. She wanted to develop this supervision, and she wanted to use it to support the up-and-coming social workers who are also experiencing the pandemic. She didn't want to stop at just supervision. She became interested in reflective and reflexive ways of thinking. She wanted to stop and think about her practice. She wanted the time and the space to be able to analyse her decision making, to link her theory with her practice and relate it to the situations that she was encountering. She wanted to then deepen the process of reflection and examine her own core values, her own bias, her own attitudes and values, and consider their action on both the families and on self. She wanted time to think about how she practiced. She didn't just want to do it. So, what did Jack learn post-pandemic? She took away the need, and I think it is a need to be reflective, reflexive with supervision, to have that time and safe place to do that uninterrupted, to examine self microscopically and the impact on practice, to gain a deeper understanding of the families that she works with. And this is ultimately going to lead to improved outcomes for children. And she wanted to pass on, to share, to open out this learning with the ASYEs to ensure that they have dedicated reflexive supervision time. So post-pandemic, social workers are emerging with a renewed sense of purpose based on a willingness or necessity to unpick their practice, examine and analyse not only their practice, but their fundamental beliefs and core social work values. And final words from Maya Angelou, who is, she's a favourite author of mine. She's learned that people will forget what you do. They might even forget what you said, but they won't ever forget how you made them feel. So I hope to have triggered thoughts about reflective supervision and the valuable role that it plays in our social work practice post-pandemic. It's also a critical way of thinking that you can apply to all different aspects of your life. I welcome any questions, thoughts, muses. Thank you very much.
Thank you so much, Jacqueline. That was great. And I think it's a really important question actually to ask, and hopefully we can have a discussion about that after. I mean, today when I was listening to you, I was thinking about whether actually the pandemic, whether the changes in practice have provided us with more space to think and reflect, or whether it's limited them, and the impact of people's working relationship, how they've changed or impacted, and our ability to spend time talking about things. And because I think, as Isabelle said in her talk, that actually it's those, often in social work, it's those connecting spaces, isn't it? It's the time in the kitchen when you had those conversations. And I wonder if actually what impact COVID's had on those spaces that we spent a lot of time talking in before COVID, and whether we managed to eke different ones out. And I think Alison talked in hers about her talk about ways in which Wolverhampton had tried to provide those spaces. So I think that'd be an interesting discussion.
Yeah,
thank you very much. And last but not least, Serena, thank you for agreeing to take part in this, and I'll hand over to you for your contribution, which I think is going to be, you will have been very significantly impacted by COVID as one of the students who's had both placements significantly disrupted by it. So I think we all are really eager to hear what your experience has been and what you think we should take from the learning we should take from that. So thank you, I'll hand over to you.
Thanks, Susie, and thank you for giving me the opportunity to share my placements experience today. As Susie has said, I've experienced 2 placements during COVID, and they have been challenging. They've taught me quite a few lessons and provided me great opportunities. My cohort, the class of 2018, is a cohort to watch out for. They're absolutely amazing students. They work really hard and they've gone through a lot of struggles to get where they are. So yeah, big up to my cohort. They have, as a cohort, we've been really close. We've been sharing ideas. We've been supporting each other from the start of the placement. I remember when our first placement in January 2020, we were all excited about starting our placement, 70-day placement. Everyone was excited, enthusiastic, motivated. I remember seeing pictures of students on placement where they were showing their breakfast, where they're showing their commute, where they're showing their pub meals. And it was the 27th of March 2020, my day 48 of my 70-day placement. We were, and also the final day of my practical experience on placement. We were, the university, like many other universities, notified us of the suspension of placements and face-to-face learning. and all those text messages and WhatsApp messages that were positive, that were enthusiastic, then were replaced with stress, anxiety, uncertainty. Our future placement was unclear. We didn't know when we were going back. Initially, I remember thinking it took a long time for a response, but in reality, it didn't. The university were really quick in responding and finding alternative solutions to continue and facilitate our learning. We were introduced to several pathways, and depending on which criteria you fit into, you took that pathway. Now, I felt that did divide the cohort, because some of us were put on a pathway where we had to provide academic evidence and complete academic tasks, and we were able to complete our placement within the anticipated timescale. Others they had to wait until it was safe to resume and complete their placement, which for some meant that they didn't finish until September 2020, leaving a smaller break, and then to start the next placement within a month. So yeah, there was a lot of people that were unhappy with the outcome. Some wanted the practical experience and some wanted the academic tasks. Unfortunately, we can't keep everyone happy, but it was a well-considered pathway in the time we were given. My 100-day placement was a virtual placement, and I remember thinking, this is great, this is amazing, I get to work at home. It saves me time commuting, which means an extra hour in bed. I didn't have to worry about childcare. I didn't have to worry about travel expenses, a new wardrobe. It just sounded ideal, until it took me about 2 hours just to find a document on SharePoint, whereas if I was in an office, that would have taken 2 minutes. I went into an office, picked up my laptop, and everything was virtual. My induction to my team, my training, and my communication with my service users was virtual. Now, I remember last year of the first placement, I was told before pre-COVID, then the placement offered me, they offered the opportunity where me and my peer could work from home. And I remember the academic tutor at the time said, no, you can't work from home, you can't work remotely. I wasn't given that opportunity. Now I understand why that they said you can't work from home, and it's not recommended, because there's a lot you learn from being in an office and sharing that same office with colleagues. You share ideas, you learn knowledge, you get knowledge from the same place, from the office there within that moment. We missed out on that opportunity learning virtually. There was instances where I was struggling and I was on my own, but there wasn't anyone around. So I did have to reach out to him, but it took a while. So it wasn't like I was in an office and I could get that information straight away. Jacqueline, there were quite a lot of challenges using virtual technology, digital communication. It wasn't the same. So although virtual technology isn't the same as face-to-face, it does have its advantages. And I was able to complete my placement virtually. I was able to meet the requirement and meet the PCFs virtually. And that was because of the support. I was in an organisation and they gave me plenty of opportunities to meet those PCFs. The university staff, they were able to support us. We struggled. They set up support groups, reached out to them, and everyone was willing and accommodating. Supervision was a platform I used quite often to reflect on how I felt. I remember feeling I think it was around December, January, feeling really down, I was struggling, like many of our students, they're all struggling. And I remember speaking to my practice educator and saying, I don't think social work is for me. I was feeling emotionally down. That wasn't because of the placement. It was down with the impact of everything COVID brought to me and my personal situation, which it was in fact impacting my placement. So having the additional responsibilities of the children, homeschooling them, it wasn't easy. And I remember my practice educator saying, stop being tough on yourself. Everyone's going through this situation. Everyone is finding this challenging. And that's when I realised that everyone's in this together. We're all challenging, not just students, the organisation, the university. This is new for everyone. It's not an easy experience. And that's when communication came into place. So I started communicating with my practice educator, more practice supervisor, the organisation and the university and other students. And we all shared our experience, and that made it easier. It made it easier to get through because we were all going through the same struggles, and we were learning new ways of being creative, innovative, and it worked. For some of us, it worked. Some of us still continue to find it challenging. And that was probably because they didn't have the opportunities or the consistent approach. That organisations weren't consistent. So some organisations did adapt and made it easier for students. Some probably didn't, or they had a different experience with different practice educators. I was fortunate. I had a good practice educator. I had a good practice supervisor, and I had a good organisation. So I did accelerate in my placement. Unfortunately, some didn't. What I would take from this is what I felt during the pandemic and how others responded. And on that note, I want to thank everybody. I can't mention names because I wouldn't be able to say that before 2 o'clock, all the names that I have to mind, but I want to thank the academic staff. You have been really supportive. Every time I've reached out, you've responded. I want to thank my practice educators and my practice supervisors for all the support and the opportunities you gave me. And most of all, I want to thank cohort 2018. You were amazing students and you supported each other, and we've got through this. Some of us, but maybe not, and you will, but you'll make fantastic social workers. Well done.
That's really excellent. Thank you, Serena. That's really a great insight into what, as I say, I think we know has been a really difficult experience for your cohort of students. And I think interestingly, you sort of ended where Isabelle started, really, which was thinking about this, that actually that this is a pandemic which has really impacted on everyone. All across the board, and I think understanding the impact that it's had on each person is really important. And so I think that's why it's really important to have these conversations together. I think what we have seen is the similarity actually at all levels in how the COVID has impacted upon people. So can I just ask for people, is anyone, I should have mentioned it earlier, if anyone's got any questions for the panel, can you put them into the Q&A box, please? There are a couple of questions, and I think there's one in the chat as well. But one of the things that I just wanted to sort of kick off with in terms of questions was around sort of communication, really, is what people think. Some of you have already talked about it, but what you think the impact upon communication has been through the pandemic. What do you think the key sort of features of the pandemic has impact in terms of impacting on communication? And I'm thinking about impacts communication between agencies, between staff, between one agency and partner agencies, between government and local authorities, and government and individual social workers, and then social with families. So I don't know, do you want to start with you, Alison? I imagine this is something you thought about or have battled with a lot.
Yeah, so I think what we've learned is we've had to be more purposeful around opportunities for communication and thinking about how that's delivered and how it's received, both within our organisation, with the children and families we're working with, but also how we're receiving, you know, guidelines, changes. And I think we've had to think about how we do that differently, and how there isn't necessarily an approach that's right for everybody, and think about how we do that. So it's, you know, reflecting on what we've been talking about earlier on, you know, the communication within teams, you know, we all know how important that is from, you know, from everybody's perspective, that everybody has agreed that. So because we haven't been able to do that in the same way, we've really had to think about how we can recreate opportunities to have that informal, that reaching out to each other, that chat that you gather, that you learn from, and that you continue to reflect and learn on throughout your career, and opportunities for that. And so I think it's made us be more purposeful in what we do and thinking about that. But communication is crucial, because that's how you stay connected. It doesn't matter who you're connecting with, that is how you stay connected. So yeah.
No, that's great. Thank you, Alison. Isabelle, do you want to go next?
Yeah, so absolutely agree with everything Alison said. I don't want to repeat that. I think overall, you know, certainly communications, I think, between partners and between government and local authorities, certainly with the social work networks and the departments, they all, you know, radically improved, both at sort of, you know, local and national level. And I think it's kind of, you know, what took us so long in a way, you know, because it really just made us, you had to talk to people. You couldn't kind of pass that off and hope it was all okay, you know, you just needed to keep on talking to each other. And just that, you know, that sense of well, obviously being in an emergency, but kind of common endeavour, I just think opened doors, you know. And it was our problem. It wasn't their problem, or, you know, social care's problem, or the school's problem, or, you know, it was just different really about how we work together. And I suppose that's one of my big hopes, that we don't sort of slide back into some, you know, bad behaviours, which we're all guilty of, you know, at points. But I think you know, there's a lot of, you know, deep thinking, isn't there, to be done about how we make sure that we don't overuse, I suppose, the virtual benefits that we've got used to the detriment of children and families and the way that they feel. And I totally agree with Alison's point, is that this is a kind of very personal thing, isn't it, on some levels, and different families, different children, different young people will want to communicate in different ways and at different points. You know, there's nothing sort of static about this. That sort of lends itself back to that theme I was talking about, you know, about being much more fluid and not getting stuck in that this is the way we do things and therefore nothing changes. Or your point, Susie, which I loved, was, you know, or if we want to change things, it doesn't have to be that difficult. You know, it's like, it doesn't have to be so laborious and take so long. You can just kind of do it, and then kind of roll with the other consequences that you hadn't thought through, and try and navigate that. Yeah, it's absolutely fascinating. And just one last point, I thought that I don't know if you've got any health colleagues in the audience, but one of the things that you know, and within, you know, data protection rules, etc., the flow of health information, from what I understand, was much better. And I think that that's a really positive thing in the safeguarding space too.
That's great, thank you. Jacqueline, have you got anything you want to add on that point?
I suppose just from the frontline point of view, relationships are the cornerstone of our work, you know, making relationships, creating relationships with our children, with our families, with our parents and carers. So that was you know, that's our core business. I think now I'm more sensitive to how valuable that skill is. I'm more aware of how important it is to make that relationship, to have that relationship, however you want to make it. It could be via, you know, virtual, it could be face to face, it could be, you know, over the telephone, but it's a heightened awareness of how valuable it is to make that, to maintain as well as form, I think, for me as a frontline worker. And I've really taken that with me, and I'm conscious, really conscious now of every interaction that I have, ensuring that it's the best quality that it can be, even if it's a challenging relationship, ensuring that the dialogue is open, the communication channels are clear, and we're able to have that exchange. Yeah, so that's what the pandemic has kind of opened out for me. You can see how passionate I am.
Yeah, no, and I think that's true. I think actually sometimes you can I often say when we sort of, when we're doing interviews with students, actually communication is something we talk about really, really easily, and we all do it all of the time. But actually, when you're dealing with in social work, it's a really complex part of the job. And actually, I don't think we hover enough over it in education and in other aspects of social work, because actually it can make or break so many different social work relationships on so many different levels if you get it wrong. And if you get the tone wrong, if you get what you say wrong, if you don't understand how that other person communicates. So it's such a complex piece of social work that is just talked about. We talk about very easily without really understanding the depth of what it means. And I think that communication is definitely challenged by, well, I think we probably all know that in terms of dealing with Zoom and Teams and all of those things. So be mindful and holding on to those challenges of communication before you add in technology, I think is really important. So yeah, no, but really important.
Susie,
Isabelle,
can I come in on that? Just because one of the things that what you just said there triggered for me is that when you're in any kind of sort of change process or, you know, kind of emergency situation, then it's very easy to kind of set up all those lines of communication, yeah, because it's sort of instinctive that that's what we do. And then when things start to get better, our instinct is to try and kind of close some of them down because it's all kind of busy and it takes up a lot of time. And actually, it's a really bad mistake to do that. And I'm just reflecting on, there was one point in the department where we were having weekly calls with both the practice leaders and the principal social workers. And after a while, and it had all kind of calmed down, I was thinking, oh, well, you know, maybe that's, you know, we've done enough of that now, you know, we should just start something else. And everyone was like, no, we're going to keep on going. And there was a real need for it. And I could have so easily kind of closed it down, not completely, but just sort of reduced, etc. And actually, it's probably now just as much as ever where we need to keep those lines of communication going, maybe in slightly different ways, because, you know, we are just at the beginnings of coming out of that emergency phase.
Yeah, no, that's great. Thank you. Serena, is there anything that you wanted to add on the point of sort of communication and how that's worked?
Yeah, I think communication has always been an issue in social work, to be honest with you. So there's always miscommunication and there's been, you know, missed opportunities. I feel like with the new way of working, we've got additional resources now, so that hopefully there should be less excuses as to why people can't communicate or attend meetings, because we have that additional platform available now.
Yeah, and I think we've definitely used those different platforms to, I mean, we've created these webinars, which is a great thing that we've used these sort of platform, these new ways of communicating for. And in some research that I've been involved in around domestic violence and how how social or how services working with victims of domestic violence have responded, actually one of the things that that research has highlighted is what Alison was saying about increased numbers and more attendance at meetings. So, and one of the things I wondered is whether actually what scope moving forward there would be for mixed meetings, really. So for meetings that utilised both online platforms and in-person meetings, a bit like the court system has done, because I think the court systems, at least some places, have had parents and their counsel and advocates in the courtroom, but social workers, guardians and other people have been outside of the courtroom on a virtual platform. And I wonder whether picking up some of those problems for parents not really wanting to use the virtual platforms, which does pick up on a question that somebody has asked, which is about how we stay connected with families that don't have full access to internet or technology, is actually moving, do you know what I mean, how we be mindful of that. So utilising these new technologies, actually how we accommodate those people who perhaps don't have that access to those technologies. I don't know, should I come back to you actually, Alison? How have you dealt with, I suppose firstly is, how have you dealt with families that don't have access to those technologies? And what are your sort of thoughts of how you might continue to use the technologies moving forward, whilst accommodating for the fact that some families either don't have them or can't use them, which is...
Yeah, and I think that's important to be thinking about as we move forward, because we've talked about how, you know, we've quickly adapted and we've utilised this system and this technology and this kit, but actually it would be a massive assumption for us to think that everybody is going to have moved at that pace or have access. So, you know, what we know is that families don't all have the digital access that is required to be able to carry on your general life. And we know that, you know, more deprivation, loss of income that families are experiencing, that then actually their access could get less and less in terms of accessibility. And so it's important for us to be mindful of that, thinking of, and I think I said this at the beginning, thinking of different ways, and that although you might have a principle of an operating model, how you think about difference and how you are inclusive as possible in how you work to make sure that you've got different ways, different means of communicating, adapting to the needs of the people that you're working with. So, you know, we have utilised other means. We've, you know, continued to utilise phone calls and bringing in people through phone calls. We've continued to do visits. We've continued to see families and bring them in through that way, utilising our own kit. So we have found ways, but I think it's important for us to continue to be creative and flexible in terms of enabling children and families to communicate with us, and not place additional barriers in the way of us being able to work with families. And it is about thinking, you know, one size isn't going to fit all. It's about an approach that meets the needs of the people that you're working with. I mean, you're still on mute, Susan.
Sorry, I'm still... It's had to happen at some point, didn't it? So Jacqueline, did you want to come in on that, given you talked quite a lot about like sort of communication in your presentation?
Yes, I do know that there are, as well as the standard telephone, Teams, Zoom, there are young people apps now that young people are in charge of, and they control where their message is sent and how it's sent and when it's sent. So although, yes, you may be at a disadvantage because you don't have an iPad, or you may not have the latest, that there may be a phone in the home, and certainly young people of a particular age, you know, kind of early teenagers, are almost certainly do have mobile phones. So I think in amongst the whole sort of COVID pandemic, there are some strategies that have emerged to giving young people a little bit more power and a greater voice. And that's just one example. But I'm a firm believer, I don't think anything beats face-to-face. And even if the risk is low to medium, I still think some things may not be interpreted correctly over a phone or over a video. You may miss something, you may miss some eye contact, you may miss some body language, things that you can't see from here on down. So I know this buzzword is on the horizon, the hybrid approach, which is, you know, virtual, face-to-face, coming together and working side by side. And that seems to be coming out of COVID. That seems to be the approach that we're going with.
No, I mean, I agree. And I think I would agree with you. And I think, again, that's something that came out of our research with people who were working in domestic violence, and they said sometimes actually you could miss quite big risks because you couldn't see. So it was difficult to challenge people, was one of the things that some of our research was saying, because if there was they went into a house and someone was saying there wasn't a problem but there was holes in the doors and things like that, they could use those other things around the environment to sort of challenge some of the behavior, which was not so easy over the phone. And so yeah, so no, that I'm sure that's a fairly common thought in terms of practitioners. Serena, what are your thoughts? Do you on engaging with people, how other people have responded? So I'm guessing you've been dealing with some children and mainly foster carers.
Yeah, I think like Jacqueline's little story about Jack and not being tech savvy, there were quite a lot of service users that aren't tech savvy, and it was just putting yourself in their shoes, and you know, if there's not appropriate training available to go out and use different creative ways of communicating, follow the PPE risk assessments were carried out, and then we'd go in and stand in the garden and we'd do an assessment in the garden. So it's just making sure that they were comfortable with the form of communication you were using. And yes, things were misinterpreted, or if you know, the issues of technology, important information was missed. So it's to ensure that you go through that information again and get their clarity of understanding, summarising, and putting it in writing as well. So the key points would be sent by email to clarify information. So yeah, it's just ensuring that you meet the needs of your service users and use an appropriate form of communication.
Isabelle, is there anything that you'd like to add about that?
Well, I know. I mean, one thing I suppose, which is it's really important that we remember that actually many people that we work with, children and families that are living in poverty, etc., their access to digital communications is much lower than we might imagine, and we just got to keep remembering that. Can't make an assumption, can we?
No, that's great, thank you. So we've got a question. It's a fairly lengthy question, so I think it's probably fairly self-explanatory. So it's from Warren. The pandemic has accelerated and exacerbated even deeply rooted socioeconomic problems that some communities experience, and this is where social work is more focused. So Wolverhampton is one of the 20% most deprived unitary authorities in the country, with more than 26% of children living in low-income families on pre-COVID data. So, and the government talks about the government publishing its levelling up white paper to address regional inequalities. And I think the issue of inequalities in the West Midlands particularly is an issue, isn't it? That so I suppose what he's asking is, do the panel feel that the decade of government austerity measures, if they're not reversed, then will will that impact upon struggling neighbourhoods and inevitably result in more children receiving social work interventions? So I suppose essentially is there a need, as the pandemic is shown up a need for more money in children's social care in order to prevent it, that the pandemic having an impact on children, and do you know what I mean, the need for social work services, I suppose. Shall I come to you first, Isabelle, on that? I suspect this is not the first time you've been asked these sort of questions.
No, it's obviously a really important question, and so I think there's a sort of general comment, which is, you know, and I think I said this in my contribution, is that the kind of economic and social consequences of COVID are absolutely massive, and we're only at the beginning of understanding how big that's going to go, and all kinds of impact on the economy and the relationship with poverty and family stress and family breakdown and so on and so forth. So I think that's sort of a given. And you know, I think the challenges for this country going forwards are massive, and I think that the spending review later on this year will be you know, a very important one, and will tell us a lot about the direction of travel. I think that there's a peculiar thing going on though, and this is linked to my point about the numbers of looked after children being so drastically reduced overall, and let's kind of we accept there's a kind of variation. But of course the biggest part of the budget in the children's social care service is the placements budget, yeah. And if we've had this a massive decrease in numbers of new children coming into the care system, then that's going to impact on budgets. Now the total number of looked after children is still slightly higher, and that's because a lot of children haven't left care that would have done normally. So there's a sort of lag here where, you know, we're going to see a lot of children move on. And even if we got back to normal levels of looked after children, it's going to take some time. So I think that this is the conundrum that we need to focus on, really. Well, it's not the only one. That's one of them anyway. So what does that mean in terms of the kind of budget management for the next 3 years or so? And then going back to a sort of broader point, and again, you know, lots of people are talking about this, about how, so there's an issue about money, and then there's an issue about how we respond to social need and how we understand social need and how that impacts on family functioning. And, you know, how we respond to people who are in, you know, dire social and economic services will really impact on how we practice going forwards. So, and I think the other really interesting conundrum in all of this is that, you know, so many, from my experience anyway, so many of the families that we work with, almost all of the families we work with live in poverty, yeah? But this is not new poverty, that they have lived in poverty that all of their lives, as have their previous generations. And so so I think that this is, again, that's an interesting conundrum, isn't it? Because actually there's a lot of families that we work are not newly poor, and then there's quite a lot of people saying that actually will COVID mean that people that may have coped, you know, reasonably well all their lives, etc., now find themselves in a position that they just can't do that. And that might be a new group of families who will come to the attention of children's social care, and from what I understand already are. But you know, Alison, Jacqueline and Serena might have more to say about that. Sorry, that was a bit of a long answer, but it's a big question.
Yeah, thank you Isabelle. Alison, what has your experience been in Wolverhampton of the impact that COVID's had on what are already significantly poor communities?
Okay, so I mean we've In Wolverhampton, we've been I think I mentioned it, on a journey of thinking about how we practice and how we historically had a high proportion of children and young people in care in Wolverhampton a few years ago, and recognised that wasn't right, and we needed to rethink how we supported children and families to enable them to live within their own family environment. And we did a lot of work, both in terms of our practice model, how we deliver our services, to make sure that we moved that shift to support families at the earliest opportunity in a way that families would be open to receiving that level of support, to avoid that higher level of statutory intervention that for some children we could avoid. And that's been a journey for us, and we are still on that journey, but I suppose it's reinforced our thinking in terms of our response to the impact of COVID, around how we can continue thinking about how, what that early offer of support needs to look like, in terms of, so we have reduced our numbers of children in care, and we haven't seen an increased number of children in care through the pandemic, because we have continued, I suppose, on our journey of change in how we deliver our services, and stuck with that to a certain extent through this process. We've seen, slightly more children, slightly, because there aren't children leaving the care system, as Isabelle points out. So, there are children who are very securely placed in their adoptive families and are remaining there without an order in place. And, we're keen to move those children through the court system so that they not receiving this level of state intervention that they are currently getting in terms of social work intervention. But we've been on that journey, and I suppose it's focused our minds even more about thinking. I touched earlier on in the presentation around how we've worked with our third-party organisations, our community groups, our partners in the city, to work together on that early intervention. This isn't something we can do alone. This is a partnership approach. It's the city approach to supporting families. And we've been quite creative with our winter grant funding and other grants we've received into the city to think about how we utilise those additional monies coming in, which are entirely appropriate to be spent on the impact of COVID and the families that are being impacted by a loss of income or a change in circumstances. And we've worked with our community groups and our third-party organisations in the city to create that community wraparound support to strengthen the resilience of families and communities, because communities know their families who live there much better than we do, and it's how we can work closer to work together to support those families moving forward, creating some sustainability in terms of resilience and support, in terms of community support, to work alongside that early intervention from social care. It's a continuous journey. It's, we need to be mindful of the additional impact of COVID and how we can respond to that. But we also need to continue to be creative around how we utilise the resources we've got to avoid a higher level of state social work intervention that isn't needed, when we can do that at a much earlier opportunity, continuing to safeguard the children, obviously, that need safeguarding. So
that's great, thank you, Alison. Jackie, what has your experience been working with families and in terms of the impact that COVID's had? Have they been, and I suppose the other thing that you might know is how impacted have they been by the changes in services and the impact on other services?
Listening to Alison, a lot of what Alison was saying resonated with me, and I just kept thinking about the initiatives that we started out with right at the beginning, the food vouchers, the food banks, the home deliveries, the basic needs were covered. We really went all out, and that's continued. So I'm hoping, I mean, I'm not in charge of our purse strings, but I'm hoping that continues. I'm really hoping that continues. But the families that are coming through our front door are a mixed bag, and I'm not able to say whether or not they're new to services, whether or not they're all I can say is that they need a service. So I'm not really interested in what happened to get them here. That's not my priority, Susie, but they're here for a reason. So I want the resources to be able to support them. I suppose that's my focus. And it's quite, you know, it's quite narrow, but that's the way that I've got to look at it, that they're here for support, they're here for help. And it could be monetary, it could be food, it could be clothing, it could be uniform, housing, all those services we've always supported on. So in terms of what we're offering, nothing is different. It is the same. I suppose we might be wanting to offer more. We might be wanting to offer iPads. We might be wanting to offer mobile phones. We might be wanting to offer computers so that you can do your homework at home. Yeah, I don't know if that answers your question, Susie.
No, that's great, and I think it is those differences of experience. I think that's why it's great to have such a mixed panel. People do have different perspectives and they're looking at the system and working with the system from different perspectives, and I think that's important. Serena, is there anything that you want to add to that question?
I just feel my answers are slightly guarded, so this is where my learning and develop comes into place. I feel like the pandemic has highlighted existing problems as well. So not only has it impacted with more problems and issues, it's highlighted existing issues. And I think, we need to get together and try and put some sort of strategies in place to prevent this, or I don't know, I can't even think of the word. A strategy in place to continue supporting these families that need us.
No, that's great, thank you. Now we've probably got time for one last question, and I wanted to sort of think about, Serena, because you're here on the panel and because you have had such a, do you know what I mean, you really did draw the short straw in terms of pandemic impact on education, your cohort. So what I wanted to ask you and to ask the panel really, but I'm going to start with you, is what do you think, what do you think is that your cohort, your sort of cohort of students who've not had the same sort of placement opportunities that cohorts previously will have had, what do you think you will need from employers moving forward in terms of ASYE support? Is there anything additionally that you might need, or what support do you think you're going to need moving forward, or your cohort is going to need? Not necessarily you personally, but yeah.
There's obviously a gap in learning, and what we've learned is a new way of communication. I think we've not had the practical experience of being there in the field and doing a lot of stuff. We've not had the experience of working alongside other professionals. So there is a gap in learning, and I'm hoping when we do get that experience and when things do get back to normality, the organisations that we work for are mindful of that, and they have provisions in place, so they're able to support us with extra additional supervision, training and new opportunities to fill in those practical gaps.
That's great, thank you very much. I'll come to you next, Jacqueline, as well, just because actually obviously in your role you will have been coming into contact with students you will already have some experience of students who had their final placement disrupted. So what's your experience been of what they've needed in terms of support?
Serena, I understand your position and the disadvantage that COVID has kind of put you at. The ASYE programme at Birmingham Children's Trust is a 2-year programme. So we recognise, we absolutely recognise that you are coming with not all the tools in your kit. We realise that there are some gaps. We know that. We absolutely know that. So we are working closely with team managers. We are working very closely with our partners, our multi-agencies, to ensure that you have the shadowing opportunities, that you're able to see court in motion, that you're, you know, virtually or non-virtually. But be assured that you won't be out in the field hitting the ground running, not at all. I think my role is to ensure that you are confident, capable, competent, and above all, ready. You've got to be ready, you know. And a good ASYE programme recognises the pandemic and the effects of that and the disadvantages that it's placed on social work students and, you know, our current ASYEs who are going through the programme, and we're doing everything we can to fill those gaps.
That's great. Thank you, Jacqueline. Alison, shall I come to you next?
Yeah, I'd just echo what Jackie says. I mean, it is about being a responsible employee, making sure that people you employ are equipped and able to do their job, and recognising the different experience that students that have had over the last couple of years have gone through to get to the point of becoming a qualified social worker. And we all know whatever your experience going through, when you actually hit the ground running, it's a different, you know, it is a different, and we need to be mindful of that. You're right, Jackie's right, you know, we're doing things through our programme around how we support our students currently, our new social workers join us as ASYEs, and so I think, you know, all local authorities and all employers who employ social workers will need to be thinking about the difference and how they support for opportunities that they've missed along the way in terms of that learning opportunity as a student. Yeah.
That's great. Thank you, Alison. And Isabelle, do you want to have the last sort of 30 seconds on this?
Yeah, and I'm going to have 30 seconds and then I'll go because I've got to shoot off. But just to say thanks, Susie, it's been a really great session. I really enjoyed it, and lovely to meet the other panelists. I suppose I was just thinking when everybody else was talking is that, and we've talked about this kind of kinder approach to families, and my sense is that because you know what the pandemic has done has made everybody realise just how important frontline practitioners are, you know, and without those frontline practitioners properly supported, you know, feeling that they've got the skills that they need, that they've got the supervision they need, the support they need, then we're kind of sunk, you know. And so kinder approach to families, I think there's probably a kinder approach to practitioners as well, where, you know, the leadership just sort of recognises just how important it is to support people. And, you know, and I was just thinking, you know, listening to Serena speak about, you know, about coming in and not having had some of those really critical opportunities, you know, like being in multiple houses or working alongside other professionals. I mean, that in itself is a real skill, you know, about how well you rub alongside the, you know, the multidisciplinary scene that you're working in. And those are they are things that you learn, you know, as you go. And so I think the students and ASYEs are moving or already in a culture which has also shifted, I think, over the last 12 to 18 months. And, you know, everyone, I think, just wants to do their best that they can with the resources that they've got. I'm going to go, but thanks very much. I really enjoyed it. Thank you.
Thank you very much, Isabelle. Thank you. And just to say, actually, we are going to end the webinar anyway, but that I think it's important, Melody has said that actually that her manager is offering her additional shadowing opportunities and training opportunities. So that's good to hear, actually, that employers are responding to and recognising the challenges that you talk about, Serena. So I just want to say thank you to everyone for coming, and thank you to what has been a really great panel, and I think a really important discussion that I hope we can all continue to have moving forward. I think we are going to continue to have that, from how we manage placements to how local authorities manage services and work with families. This is the last of the webinar series for this semester, but they will start up again in September, and we have already got a webinar sorted on with Donald Forrester on motivational interviewing with children and families, and one around the recent report around social deprivation and child death and social deprivation. So which will be, again, really important in the context of what's happening around COVID and changes around social inequality. So hopefully we'll get some additional, well, I will get some additional webinars put in. If anyone has any ideas, then please feel free to get in touch, but they will remain free to people to come to. So hopefully, Serena, as well, these are things that you can continue to tap into to get additional sort of backup to what you perhaps, let's say, you perhaps have missed in terms of education. But again, thank you very much, everyone. Your support with these webinars is really, really valued, and I look forward to the next series in next semester, and working with our colleagues in our local authorities. So thank you, everyone. Alison, Jacqueline and Serena.
Thank you.
Thank you.
Bye, everybody.
Bye.
Bye.